Hi, this is Malcolm Wright from EQUICARE Health. In this webinar, I'm going to go over the Meaningful Use Patient Electronic Access feature included in our patient portal. Our patient portal makes it easy for patients to access their health information summary. A simple overview of the feature is displayed to the patient directly on their homepage, and patients can initiate the workflow with the click of a button. Their health information summary contains all the elements that are required for meaningful use, including their problem list, their medications, and their lab test results. Patients can also download a copy and save it to their local drives, another requirement of meaningful use. Finally, they can securely send a copy to another physician using the direct transport standard. So I put in my physician's direct address, I put in my message, I send it, and the document now shows up in their electronic health records system. Patient electronic access is number 8 of the 10 objectives included in Meaningful Use Stage 2. So it's mandatory for providers wanting to attest. Electronic access is also referred to as View, Download, and Transmit, or VDT. There's 2 compliance measures for VDT. First, at least 50% of a provider's patients must have timely online access to their health summary. We make this really easy to achieve since patients simply need to be invited to our patient portal to be included in this measure. Second, some of a provider's patients have to actually view or download or transmit their health summary. For 2015 and 2016 attestation years, only one of a provider's patients has to do this. For 2017, at least 5% of their patients have to do this. And again, we make it really easy for patients by providing them with a simple workflow to do the VDT of their health summary. One of the greatest challenges with meaningful use is keeping on top of the operational steps that have to be completed for each patient to meet the objectives. EQUICARE can help you with this with our Meaningful Use Worklist. In the worklist that I'm looking at, I see all the patients who've been registered at my facility in the past 7 days. For each patient, I can see basic information about them, their name, their age, etc. But I can also see the status of each of the operational steps that's required to meet the patient engagement objectives. So for example, I can see if they've been invited to the portal, or if they haven't, this is necessary to meet measure 1. Or I can see if they've VDT'd their health summary, which is necessary for measure 2. Since this is an interactive worklist, I can address non-compliance issues directly. For example, if I see that this patient here, Gail, hasn't been invited to the portal, I can address that immediately just by simply going in and printing off her invitation. So when I come back to the Meaningful Use Compliance worklist, I can see that now she has met that compliance measure and she will meet the measure in meaningful use. EQUICARE also makes it easy for facilities to complete meaningful use attestation because the patient engagement measures are represented on a meaningful use dashboard. If you're using ARIA at your facility, we automatically update the ARIA meaningful use dashboard seen here. If you're using Mosaic or another system, you can rely on the meaningful use dashboard built directly into EQUICARE. This is available under Analytics, Meaningful Use Dashboard. Once I select the physician, stage 1 or 2, and the time period, I can actually see each of the measures represented on the dashboard and the individual thresholds and current status highlighted. So I can see I've met this measure and this measure, but for measure number 1, I am still below the 50% threshold. Reporting is also easy, and no one has to track or calculate individual compliance rates manually, and you have a full audit trail of which patients met each compliance measure. Thanks for your time today. If you want more information, please visit our website or send us an email. Also, feel free to watch other webinars in this series, also available from this website.